following is brought to you by Alberta Milk, representing Alberta's dairy farmers.
So mastitis is an inflammation of the udder of the cow. It is caused by a lot of bacteria, particularly, and we see the biggest problems around calving. So after calving, particularly in heifers, first calving cows, we see a huge peak in the number of cases of mastitis. And that often goes back to the dry period of the cows. So we see differences in the milk, changes, clots and those kind of things. But that's less common. You see a really inflamed udder and a sick cow. So mastitis prevention and management really depends on what the situation is on your farm. You have to look at the bulk milk somatic cell count. So it's quite different if you have a higher bulk milk somatic cell count, let's say in the range from 300,000 to 400 or even 500,000, than when you have a somatic cell count, so that's the number of inflammation cells, white blood cells in the milk, that is very low. Because typically with a low somatic cell count there are other bacteria that play a role than with a high somatic cell count. It's actually not that difficult to change the mastitis situation when you have a high somatic cell count. We have a solution for that, and that is all in the spread of bacteria and preventing that. So we still have a lot of farms, 3 out of 4 actually use dry cow treatment at drying off with antibiotics, but 1 out of 4 doesn't do that. And those are typically high somatic cell count herds. So that's one of the measures that all herds with a higher somatic cell count really should do, if they're not an organic herd, of course. Then post-milking teat disinfection, so dipping, and dipping being better than spraying, is done on nearly all the herds, but I occasionally find a herd that does not do it, and they typically have a high somatic cell count as well. Then, of course, maintenance of the milking machine. It is really necessary to get the milking machine serviced at least once a year, but better every 6 months. It is more important to service your milking machine than it is getting your car checked, because you earn your money as a dairy farmer with the milking machine. So it is really important to get that serviced at least every 6 months. And then of course the milking technique, and consisting of a lot of different parts is very important as well, so that every cow every time gets the same treatment, and that bacteria are not spread during milking from cow to cow. So individual paper towels is really important. Then mastitis treatment. So if you have a clinical mastitis case, then it should be treated with antibiotics. But we are now more and more also going to only treating the mastitis cases with antibiotics that are actually caused by the bacteria that are susceptible for those antibiotics. So we're developing techniques now so that we can quickly culture mastitis and know whether these bacteria will be sensitive for it. Because the less antibiotics you have to use on the farm, and the best ones for that bacteria, the better it is. And then of course, mastitis is spread from cow to cow typically. So if you have a cow that is really chronic with mastitis, it's better not to breed that cow, and so that she will leave the farm at the end of the lactation. So those are the 5 most important groups of things that you can do, particularly on a high somatic cell count herd, to prevent mastitis. So that is post-milking teat disinfection, it is maintenance of the milking machine and a right milking technique, it's dry cow treatment with antibiotics, it is clinical mastitis treatment and the right one. And it's culling the cows at the end of their lactation if they have chronic disease.